Hi everyone, and welcome back to Excellence Now, where we seek to raise the standard and change the status quo. For this video, I was just thinking, what are the qualities of a good nurse? I did ask some of my colleagues about it, and I will just show you what a few of them said.
I think a nurse should be a good communicator because we deal with a lot of different departments and different backgrounds, so it's good to keep the communication good so we all know what we're doing.
As a nurse, I think we have to be an advocate for a patient. Like where I work, my patients are sedated and ventilated, so you need to speak on behalf of them, sometimes in their best interest.
As a nurse, you have to be a very good team player because we work with many different teams like the physio, the occupational therapist, the doctors, so we work together to achieve a common goal.
Now, everybody's different. All nurses have different personalities, but there are some key qualities that you should have as a nurse in order to be able to be efficient and effective in your workplace. Number one, you need, all of these are just my thoughts, okay? This is what I believe. It's not, it's not doctrine, and that doesn't mean because I say that these are qualities nurses should have, that means I have all these qualities and I am the best nurse in the world. I mean, I'm trying every day to improve myself, but if you want to be the best at your job, these would be some good qualities to work on. So I believe that as a nurse, you need to be knowledgeable. At least know what you're talking about. Sometimes, to be honest, I really do not know what is happening, especially with the doctors. Like, why don't you just use English? Like, sometimes they really just use the most complex terms and words to explain what they're trying to explain, and I'm on the rounds and I'm like, yeah, I'm just nodding, but there's no way. Nobody knows what they're talking about. But guys, you need to be knowledgeable. Whatever field, whatever area you work in, you need to constantly be studying, refreshing your knowledge, always reading on the latest guidelines about things. Like my clinical educator always says, you need to read the guidelines. Yeah, so always refresh, always know what you talking about, because you would be respected by your colleagues, especially the doctors as well. If they can see that you know what you're about, they would quicker respond to you knowing that you're somebody who is knowledgeable. Number two is a good communicator. As a nurse, you have to be able to communicate. You're working with so many different people from different teams, and you have to be able to speak on behalf of the patient. You have to get information across. You cannot be a nurse and you're saying, oh, you're trying to get the doctor, let's say in an emergency, you're trying to get the doctor to come, you're like, oh, hi, Dr. George, the patient is not doing well. You can come and see the patient. And then Dr. George is like, what's happening with the patient? And say, the oxygen is going down. The patient, you have to be able to say what you want to say, get that point across, get it, especially if it's an emergency, you have to be precise, and you need to do it in quick time. Another good one I would say is to have good interpersonal skills. You have to be able to get along with your co-workers. Nobody's saying to like them. You don't have to hang out with them. They don't have to be your friends. You don't have to speak to them on WhatsApp or online. But when you come to work, you have to be able to get along, because as a nurse, you will not be able to do everything by yourself. If something happens and you suddenly need to roll your patient or sit your patient up or something like that, and you're not speaking to that one, or you don't like that one, or whatever, you're going to be left alone. So you have to be able to put aside whatever differences you have, whatever emotional trauma and emotional stuff you have going on. Anything to do with emotions, please leave it at your house. You just come to work, you help everybody, right? You don't expect people to help you only. You have to be able to help other people, and so in turn they can help you. And then you come and you be respectful to people. Don't disrespect anybody. Don't treat people the way you wouldn't want to be treated. And so people will love working with you when they come and they see, oh, is that person on the shift? They know they're going to have a good time, so and get the work done. So you have to have good interpersonal skills and good conflict resolution skills as well. Another one I believe is very important is you cannot be shy as a nurse. You have to be an advocate. You have to be able to stand up for the patient. And how are you going to stand up for the patient and you're shy? How are you supposed to say, oh, something is happening to my patient? Let's say your patient is there, the husband came to see her, and then the husband started shouting at her, and then she was telling him something, and the husband gave the lady a hard slap across her face. And you say, oh, excuse me, sir, you're not supposed to beat the patient, you know? So like these things you have to, if you know you're a naturally shy person, start working on it, start practicing speaking up, because as a nurse you have to do a lot of speaking up. You have to call the doctor and say, okay, I need this and this is happening and I need you to come to do something. If you're talking on the phone, excuse me, doctor, like nobody's going to take you seriously. And even when like the doctor says something that you don't think is right, or you don't think that it's best for the patient, you have to act in the best interest of the patient, and you have to be able to say, no, I don't think this is what we should do. You know what we should do? Maybe we can get a second opinion. Or if you don't feel comfortable, just tell them I'm not going to do it, and you do it yourself. But you cannot be shy, because how are you going to stand up for anybody if you're shy? Another quality that is very important, very vital, is patience. You have to be patient. And my biggest struggles when it comes to patients is patients who are not intubated. Because in ICU, you're just so used to peace, except the monitor's alarming. And so it's very difficult for, I don't know for others, but it's difficult for me to transition to now having a patient who speaks. And the speaking is okay, but it's just different where now, like it's just different. I mean, if you're an ICU nurse, you understand. Because you're so used to just doing all of your stuff as normal, and then now you have you feel like there's a lot more interruptions from patients, like if they need something to get that, and you feel like you cannot really flow. But you should be able to adjust as a nurse. You should be able to adjust. And even if you feel like you maybe you're struggling or you're overwhelmed, you just take some time, but you never be impatient with the patient. You never make them feel like they're bothering you or that they're stressing you out. Okay, you have to be patient with colleagues. You have to be patient with doctors. Oh, you have to be patient with doctors. Yes, you do. And so you have to be patient and very compassionate. I know sometimes being in nursing or healthcare, we take things for granted. Like, we have that kind of dark humor where you'd make fun of things that probably you shouldn't make fun of, but it's very important that you still remain professional and very compassionate. If the patient tells you that they're in pain, try to do as much as you can. Don't just say, oh, you're in pain, well, just try and finger the pain until the doctor come. Try, at least you want to show them you trying your best. So let's see if you have any medications prescribed for pain. If they already had their regular medication but they still having pain, see if they have anything prescribed PRN. If they have something prescribed PRN, you can give it to them. If not, you can call the doctor. If the doctor says, okay, I'm busy but I can come or whatever time, or maybe the doctor might give a telephone order and say, okay, give that for now and I will come to prescribe it. However, whatever is the policy of your hospital or your trust, you go ahead and do that. But you have to show the patient that you're actually considering their feelings. So if the patient is crying in pain and you give them something and it's not yet working, try to see if you can help them to get into a comfortable position in bed. Stay with them. Okay, so another quality I feel like you need to have as a nurse is to be thorough and kind of methodological. Oh, how do they say this word? Methodological? Kind of have a rhythm, a system, a way you do your thing, that kind of stuff. And you want to be thorough. If you're going to document properly. Document something where if they pull you how many months later or years later, you would be able to read through what you wrote, and then, you know, you'll be proud of what you wrote. Sometimes we're rushing and we're trying to get home, and so you just scribble a little something, but you never know the day you will be called to answer what's happening, you know, what is all of this and what did that mean. So you try to be very thorough. Also, your documentation is a form of communication, where somebody else will come and read your chat and try to understand what was happening, and if you didn't document properly, that some messages might be lost. I mean, I struggle on a daily basis to read what the doctors have written. I don't know if in medical school they teach them just do this so that nobody understands. I don't know what you know, I don't know. Some doctors come and they write so beautifully. They write so beautifully and you can read and you're so happy. These are my favorites. But there are some doctors, they would be right next to you, tell you the whole plan, and when you read that, it just doesn't match because you don't know if it's numbers or letters that's on there. But anyways, that's besides. This is not about doctors, this is about nurses. So yes, you want to be thorough with whatever you're writing, and you want to have a system. Okay, when you just start, you will not have a system. You will struggle. You will feel like, why did I choose this life? You will feel like that. But every day, try to give yourself little goals. Okay, you want to improve on your time management. You want to set goals in the morning and then evaluate them towards the end of the day. So you look at all of these things, and then you try to improve yourself every day. And then as soon as you know, by the time a few weeks pass, you would get into the hang of it, and you would be so proud of yourself. And the final one, last but not least, but very important, and guys, like I said, there are so many other qualities that a good nurse should have. I just really wanted to speak on these, and so you can do your research, but I hope that this video helps any nurse who's trying to improve their care, improve the efficiency, and just to be an all-round better nurse. And also new nurses or nursing student, this video will be good for you as well. But the final one is to be humble. You know what, like, really throws me off? Nurses that feel they're better than other nurses. Like, I don't know, it really just, yeah, like, I mean, everybody does things differently and people might make mistakes, or you might do something that's a bit odd, but to literally be like, that person is dumb, or that person is lazy, or that person is like, I feel like that is, no, unless you're going to say something that is constructive to help the person, don't just make generalizations and sometimes what happens is that people say these things to other people, and other people already have this preconceived idea. So if they're working with you now, they're thinking, oh, she must be lazy, oh, she must be stupid, oh, she doesn't know what she's doing. So that's why I'm telling you guys, because you know I always have your back. Make sure you're reading your stuff, you know what you're saying, and sometimes you know what you're saying but you're shy, and so people think you don't know anything. People feel like, you know, you're not a good nurse because look at you. And so you need to practice all of these qualities in order for you to be able to stand out. That's what you want. As in, you want your care to be exceptional, you want your patients to remember, you want your colleagues to be happy to be working with you, right? So it's important to know what you're doing, and every day just keep setting new goals to try to improve yourself. So thank you guys for watching the video. I hope that you did enjoy it. I just tried to do a quick video for you guys. I'm trying to squeeze them in between all what I have going on, and I was really happy to make this video. So I hope that you can share it with your friends, and that you can let me know in the comment section what other qualities you think nurses should have, or what qualities you notice that nurses have but you don't think that they should have. So let me know in the comment section. As you guys know, I answer every comment. So enjoy the rest of your day.